coming to an important topic is ectopic gestation. What do you mean by gestation? Being pregnant is a state called as gestation. What is ectopic? Meaning X plus topos, away from the normal location. So what happens normally at the time of fertilization, the fertilized ovum or the zygote gets implanted into the fundus of the uterus, or the zygote will get implanted into the fundus. It is called as nidation or implantation. Now the cell starts multiplying, it becomes a blastula, gastrula, and then finally it becomes an embryo. So this is a normal site of implantation in a normal pregnancy. But in some cases what happens, the implantation takes place at the wrong sites. Say for example, it can take place at the tubes. So that becomes a tubal gestation. It can take place in the ovaries, which is an ovarian gestation. It can take place in the abdominal cavity, which is an abdominal gestation. It can take place in the cervix, which is a cervical gestation. It can take place in the interstitium, is a region which connects the tubes and the uterus. So all these pregnancies will not last long, because if you allow the pregnancy to continue, this might result in rupture of the tubes and thereby causing peritonitis and the mother dying of peritonitis and shock. So they will have to treat all these procedures. So we have separate codes for the treatment of this ectopic gestation. You should know what are the types of ectopic gestation and whether they are removing the tubes or not, because we have codes where they do salpingectomy. Okay, so you should be knowing whether they are removing the tubes or not while treating the ectopic gestation. And secondly, you should be knowing whether it is being done as a laparoscopic technique or as an open technique.